The death rate from cancer has declined steadily over the past 20 years, due in part to advances in early detection and innovations in treatment options. However, the fact remains that patients can be left having to manage a variety of troubling side effects and complications. One such side effect, oral mucositis, is reported to be one of the most debilitating. Up next, an innovative solution in support of cancer care.
I was diagnosed with early onset anal cancer. My treatment was the same whether it was stage 1 or stage 4. I had radiation and chemo. So one of the side effects I had heard about was mucositis. My mouth was kind of irritated and red and inflamed, and I thought, well, that must be what they mean by mucositis. But the next day I woke up, I had these sores like all over my mouth, and I thought, oh my God, this is unbearable. I never had anything that was that painful in my life. It stops you from being able to function or have a normal activity level. It's just excruciating pain. I started to look for some kind of solution so that I could maintain and just have a level that was bearable. And that's how I found Gelclair.
According to the American Cancer Society, approximately 1.7 million Americans will be diagnosed with cancer this year. And for the majority of patients receiving chemotherapy or radiation treatments, this can mean having to cope with a variety of debilitating side effects. One of the most commonly seen complications of cancer treatments, oral mucositis, can have a significant effect on patients' quality of life. So joining me today to discuss the supportive care solution is Deborah Gordon and Annette Quinn, Program Manager of Radiation Oncology at the University of Pittsburgh Cancer Center. Thank you both for joining me, ladies.
Thank you.
Annette, let's start with you. Can you tell us a little bit more about oral mucositis and who exactly it affects?
Oral mucositis is an incredibly painful inflammation of the lining of the inside of your mouth. It starts out as redness and swelling, and then it quickly progresses to open areas, sores, ulcers throughout the mouth. It's sort of like a bad sunburn inside your mouth. It can be incredibly painful. It affects patients undergoing head and neck radiation therapy and also affects patients that are receiving certain chemotherapies for certain types of cancers.
And it's painful.
It's incredibly painful, Erica. These patients get to the point where there's so many sores and lesions in their mouth that it makes it very difficult for them to eat.
Right. So not only are you battling this pain, but then you're not eating. I'm assuming you're not resting much?
Right. Nutrition is important when it comes to cancer therapy. We know that we're not only affecting the bad cells, but we're also affecting the good cells. So we want our patients to have good nutrition to be able to recover from the effects of the cancer therapies. So we need them to be able to eat. And when your mouth is full of these very painful ulcers and sores, it's hard to even swallow your own saliva, let alone try to get food down.
So the pain has a rippling effect, really.
It does, absolutely.
Deborah, I want to talk to you. You battled cancer, and as a result, you had oral mucositis.
I did have it.
Can you tell us in your words, what was that experience like?
I had chemo at the beginning of my treatment, and about a week later, I started to really have sores in my mouth to the point where it was unbearable. It was really extreme pain. I couldn't sleep. I had to bolster my pillows. I thought I would be able to continue doing my job. I had a lot of appointments. I showed real estate, and I couldn't talk. I couldn't leave the house. I couldn't eat. You had to keep hydrated, so you drink as much liquids as you can to avoid the sores. I had them all over, under my tongue, on top of the roof of my mouth, the hard palate, the soft palate. I didn't know these symptoms would be so extreme. I said, is there something you can please do? I can't handle this pain. I can't continue. And she was able to help me out.
This is a very common side effect of cancer therapy, Erica. Oral mucositis is very much underappreciated and undermanaged. It's in the list of things that are going to happen from the cancer therapy, but oral mucositis, a lot of patients aren't exactly sure what that is or how painful it can be. The other point that Deb brings up that is incredibly important, it's so painful to patients that they're not willing to continue sometimes with their cancer therapy treatment, which is a little disheartening because it can be managed.
So Annette, what can we do to help the patient?
Erica, as an oncology nurse, it's my job to educate the patient, first of all, in how severe oral mucositis can be. And there's a couple of things we can talk to them about. One is good oral care. Keeping your mouth, when you have open sores in there, you could be at risk for infection. So keeping your mouth nice and clean, doing rinses to help with salt water to help keep the environment in your mouth nice and clean. The other thing we could do is help with the pain. So letting them know it's very predictable. That's the one good thing about oral mucositis is we can predict with certain chemotherapies exactly who is going to get mucositis. The other thing, Erica, is we have a great product that can help with the pain of oral mucositis, and it's called Gelclair. Gelclair is an oral gel that coats the lining of the inside of the mouth, and it forms a thin barrier over the lesions to help reduce the pain. It sort of covers the nerve endings that are exposed, causing a lot of the pain. By forming that thin barrier, it allows patients, as Deb attests to be able to eat, to be able to continue to talk. So the barrier over them is very protective and helps with the pain.
So Annette, how is it administered?
Gelclair is very suitable for patient use. What you do, you just tear open the packet, and then you're going to squeeze the entire packet into a glass. Very simple. Then you take 1 tablespoon of water, 1 tablespoon, that's it. Stir it around. Then we ask patients to take the solution and swish it in their mouth for a full minute. Sometimes that's hard to do when your mouth is already sore, so I always say to them, do it for as long as you possibly can. The great thing about Gelclair, Erica, is it's alcohol-free and it's a non-numbing agent. One of the most commonly prescribed products out there currently for oral mucositis is a numbing agent. When your mouth is numb, you can't do a lot of things, and one of the risks is that you could re-injure the tissue that you're trying so desperately to heal. Of course, it's contraindicated in any patient that has a known hypersensitivity to any of the ingredients that are in the product, but otherwise it is safe to use.
Deborah, I know you had an opportunity to use Gelclair. How did it affect? Did it give you any relief?
To have something that helps your mouth recover. Anything that can cover that open wound is great. You just want to get rid of that horrible pain.
So Annette, does everybody have access to it?
Yes. Gelclair is distributed by Mitatech Pharma, and it is available as a prescription from your healthcare professional. Mitatech offers a zero copay to patients that are eligible for the Gelclair. And if patients aren't eligible, there is a patient assistance program available.
And so where can we go for more information?
You can go to gelclair.com. There's a lot of information on there, Erica, for both healthcare professionals and for patients as well.
Deborah, thank you so much for coming in and sharing your story. And Annette, what great information. I know there's so many people out there that are listening that are going to benefit from everything we talked about today. If you are undergoing cancer therapy and are experiencing pain from oral mucositis, ask your physician if Gelclair is right for you. As always, you can find the information as well by visiting our website at accesshealth.tv.